Welcome to Cancer Buzz. Today, survivorship care for patients after treatment with immunotherapy for cancer, and how we can improve care coordination and communication during this transitional phase in the cancer care continuum.
Oncology and primary care, they really do have to kind of work together in order for that patient to be treated properly and to be treated appropriately. Because there are going to be situations, particularly in the immune-related adverse events arena, where care coordination is crucial. Oncology, primary care, emergency care, hospital medicine, all of these groups really need to be involved when there is an adverse event for a patient after immune therapies.
This is Cancer Buzz. I'm your host, Summer Johnson. In recent years, immuno-oncology has revolutionized cancer care, making treatment options available for certain cancers where few options previously existed, such as metastatic melanoma. Since 2011, a number of immunotherapy agents called immune checkpoint inhibitors have received FDA approval. These therapies work with the patient's own immune system to fight cancer. For some cancers, combination therapies can be used, which can be 2 checkpoint inhibitors, or the combination of a checkpoint inhibitor and a chemotherapy, or a molecularly targeted agent. As these immunotherapies have received FDA approval and have moved into mainstream cancer care, more patients are treated with these new therapies. And that means more cancer survivors are returning to their primary care doctors with immunotherapy in their records. But these treatments are still new and unfamiliar to many physicians outside of oncology, which makes it that much harder to care for patients who've received immunotherapy, not to mention watching for those long-term and immune-related adverse events that can show up much later. How do we make the transition into survivorship care better, easier, and less anxiety-provoking for the patients, their caregivers, and professionals? Today, we look at survivorship care from the PCP's point of view, and we'll talk about ways to better plan for it between oncologists and the primary care team. Dr. Regina Jacob is a primary care physician, and she's an assistant professor of internal medicine at Temple University's Lewis Katz School of Medicine. Dr. Jacob is also a member of the ACCC Immuno-Oncology Institute Multi-Specialty Coordination and Communication Working Group. She talks about planning for survivorship with the greater team as we move forward in cancer care, where these treatments will become more commonplace for patients. And she's passionate about teaching this from the beginning, starting with her med students. When a patient presents him or herself to you after leaving the oncology clinic, what's your priority?
You want to be able to kind of calm the patient down because a lot of people who have cancers are naturally nervous about it, especially when they have to talk about cancer itself. When the visit is about what do we do to kind of follow you now that you've completed all this treatment and your cancer's gone. So I think that it's really important for us on the primary care end to be able to reassure our patients that even if we don't know exactly what's happening, we know exactly who to call. So, and I think that's the part that would be so much better if we could improve that sort of communication gap. And what's interesting is that's kind of what the data shows too. If you sort of look at the data, primary care doctors always know that there is a survivorship care issue that needs to be taken care of, but they don't know what the treatment was on the oncology side, so then they don't even know how to follow it. But if they knew what the treatment was, then it's super easy to spend some time on your friend Dr. Google and kind of learn about what the treatments are and what to look out for. If we could just bridge that communication gap, I think, everybody would feel better. Oncology would feel better that primary care knows what they're doing. Primary care would feel better that they know what they're doing. And the patient would feel better that all of their doctors know what they're doing.
Because immune-related adverse events can be hard to identify and are different than the side effects we know of from chemotherapy, talk to us about the differences in post-treatment survivorship for patients treated with chemotherapy and then those who are treated with immunotherapy.
I think the biggest difference really is that because traditional chemotherapy has been around for so long, most of us are learning about it in medical school, and a lot of that information has been well circulated over the years, and we've been able to study the long-term adverse events of using traditional chemotherapies. With the immunotherapies, they're fairly new. Because they're fairly new, we are learning that a lot of the adverse events come, much later after treatment, and they also express themselves in ways that we wouldn't have necessarily predicted. So that information is still kind of out there. We're still sort of learning about it from what my understanding. And I think that's what makes it so hard to recognize if doctors are not sort of aware of what are the adverse events and when they show up.
From the primary care perspective, what are some of the challenges managing the care of a survivor who's had immunotherapy? I can imagine one would be that very few non-oncology specialists have had a ton of direct experience treating patients who have had it.
I would say the biggest challenge in primary care really comes down to communication. I think even with the traditional chemotherapies, a lot of primary care doctors don't know what the treatment process was for their patients. And I work in an academic center. Because I work in an academic center, I have easy access to our electronic health record, so I can actually go through it and find it. But for people who are not connected within the same hospital system to their oncology practice, it's really difficult to get that information. That communication gap exists already in the traditional chemotherapies when people have a little bit more knowledge about the long-term side effects of traditional chemotherapies and radiation therapies. And if you add in the sort of lack of knowledge that there is about adverse events following immune therapy, plus the communication gap between oncologists and primary care providers, I think it becomes even more challenging.
What do you think are the anxieties or challenges from the patient perspective as they transition to survivor care?
It's very anxiety provoking to leave your oncologist for patients. I did do a lot of work talking to patients about their anxieties, and some of their biggest fears were just leaving their oncologist who was able to kind of save their life with their cancer and then go to their primary care doctor who many times doesn't know the treatment that happened. And that is a huge separation anxiety for patients, to go from a place where they were taken care of and cured and then go to another doctor who also has the same idea in mind but doesn't have the information to be able to make the patient feel comfortable.
So in the current environment, how are non-oncology specific physicians receiving the education about immunotherapies?
I would say that it's pretty scarce. I will say that I am fortunate to be part of ACCC, and I am a practicing primary care provider. And so I have gotten a lot of my information from ACCC. But I would say that in the primary care community, a lot of people don't know where to even go for immune therapy adverse events. And I think a lot of people don't even know that the adverse events from immune therapies show up so late in the course of treatment, and then also show up in sort of an unpredictable way.
When you're seeing patients, what do you do when you have a survivorship care plan for a patient who's been treated with immunotherapy? And what do you do when you don't? How do you navigate that with the oncology team?
There is the crux of the issue when it comes to survivorship care, at least from the primary care perspective. When I have a survivorship care plan in front of me, it's reassuring, and it's reassuring for both myself as well as the patient. Because once I have that survivorship care plan in front of me, if there's information that's missing, I at least know that I can look it up and find out and learn about it, and then, talk to the patient about what we should do going further. Now, if that survivorship care plan is not there, that's when things get really challenging, because number one, you have to rely on the patient to tell you where they were treated and who to contact to get that information. And like I mentioned, I have the fortunate part of working in an academic center, so I can still go into the electronic health record and find the care plans. I will admit that there are a large percentage of our patients that don't have these care plans completed by the time that I see that patient in primary care. So a lot of times I have to reach out to the oncologist and kind of ask for that care plan. And so there are sort of barriers to community primary care doctors who don't necessarily have access through the EHR to speak with oncology members. And then there are also barriers, even with the EHR, to get a response from oncology members, even if you are talking to them through the same health record within the same institution.
You talk about the 3 pillars of survivorship care: communication, care coordination, and education. Can you give us a breakdown of those?
The communication part is sort of twofold. I think I can kind of break down each of these pillars into how I see them going, but they basically are twofold for each pillar. One would be, communication with the patient in terms of what are the risk factors that they should be looking out for, what are the symptoms they should be looking out for, and who to ask and where to go when those symptoms show up. A lot of times with the immune-related adverse events, the location where people need to go might be actually an emergency setting and not necessarily your primary care doctor or your oncologist. So that is part of the communication and education part from the patient perspective about how to deal with survivorship issues that arise from immune-related therapies. The second pillar for this would be kind of the communication between doctors, and that also kind of goes through the care coordination side of things, because oncology and primary care, they really do have to kind of work together in order for that patient to be treated properly and to be treated appropriately, because there are going to be situations, particularly in the immune-related adverse events arena, where care coordination is crucial. Oncology, primary care, emergency care, hospital medicine, all of these groups really need to be involved when there is an adverse event for a patient after immune therapies.
Advances in immunotherapy will lead to more and more cancer programs offering these treatments to patients, which means more patients are going to come through the primary care physician's doors who have had it, which means communicating and coordinating those transitions to survivorship are critical. From your perspective, how can oncologists better support and involve non-oncology specialists in the survivorship care planning specific to patients who have had immunotherapy?
A lot of it comes down to education. And when I say education, it means interdisciplinary education in terms of, what are the nurses seeing on their end? What do oncology doctors see on their end? What is known in the toxicology realm about immune-related adverse events? And all of that information needs to kind of make it to the primary care channels, because a lot of times for survivorship patients, and especially when you're talking about immune-related adverse events, if you're talking about these events happening 10 years after they were treated, those patients are predominantly under the care of their primary care provider. So it's really important that the primary care provider is at least aware of what the symptoms are they should be looking out for and where they're supposed to direct the patient to go. The ASCO and the NCCN guidelines about how to manage immune-related adverse events is a very good start. Now, if we're comparing it to sort of traditional chemotherapies and radiation therapies, when you look up survivorship care plans for, say, breast cancer or colon cancer on the ASCO websites, there are a lot of well-known sort of side effects. But I will say that what needs to happen is there needs to be sort of an education front, not just interdisciplinarily from the clinical care coordination side, i.e. your nurses, your primary care providers, your oncologists, your nurse navigators, et cetera. But it also needs to be embedded in the residency training programs. Now, internal medicine training programs are predominantly where your hospitalists are coming from. And your hospitalists are going to be the ones that are a lot of times managing some of these adverse events on the floors in the hospital. So those educational pieces need to somehow translate into the internal medicine residency education, as well as the hospitalist medicine education. And I think a good way of doing that, if we're talking about sort of tangible things that we can do to move forward, would be really to have shareholders within each of those practices, like your hospitalist group, your primary care group. Those people all need to be involved in the development of guidelines and guidelines on how to direct care forward and, how to ask for help and where you get help from. So those are all kind of very relevant things that would help for all of the providers that are involved in taking care of patients who've had immune therapies.
We'd like to thank Dr. Jacob for her perspective today. You can find information and resources on today's topic in the show notes. Thanks for listening. We know you're a busy professional and we value your time. If you work in oncology care, we hope this show was helpful for you. And you may even find it helpful for your colleagues in other specialties of patient care. Please share this episode with them. On the next Cancer Buzz, we examine cancer care in rural settings, the challenges, and what some programs are doing to serve their patients despite the obstacles. Until then, for the Cancer Buzz team, I'm Summer Johnson.